Hello, everyone. Winnie Kisak. Welcome to today's event, Share Your Experience Through Storytelling. I'm your host for today, Zoe Harris. I'm a citizen of the Mashpee Wampanoag tribe, and I'm a public health associate here at NCUIH. And today's event is an information session about our new PhotoVoice opportunity, which is going to be open to those who work at urban Indian organizations. Today's session will be recorded for educational and quality improvement purposes. We ask that you please turn on your video if you can, mute yourself when you're not speaking, and introduce yourself in the chat by providing your name, organization, and any tribal affiliations. For today's session, Alyssa Wanji and I will be leading our session. Alyssa, would you like to take a moment to introduce yourself?
Sure, thanks, Zoe. My name is Alyssa. I'm a public health program manager at NCUIH. I've been working on our infection control project for 2 years now. I'm Fort Peck, Assiniboine and Sioux from Montana, and I am a registered nurse.
Thank you. This is our agenda for today. So we'll be going over several details about the project, including participant commitment, ethics, benefits, and some other helpful tips. We will also have plenty of time for questions at the end, so feel free to put them in the chat as they come up, but we will hold off until the end when we have an open floor to answer those questions. To provide some background, the National Council of Urban Indian Health, also known as NCUIH, is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is a national organization advocating for the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Healthcare Improvement Act. Before we begin today's event, we want to acknowledge that NCUIH's office in DC lies on the traditional homelands of many Native nations. Some of the communities in the surrounding area include the Piscataway, Pamunkey, Mantego, Mattaponi, Chickahominy, Monacan, and Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native people. DC is also home to a diverse Native community of tribal citizens who continue to act as stewards of this land. And at this moment, we just ask you to take a brief pause to acknowledge the Indigenous land that you're joining us from. All right, so we are going to jump right into the presentation, starting with a project overview. Just as a note, if at any point you decide you want to get started on your application, you can use the QR code in the right-hand corner or use our short link to access the application. And Alyssa just put that in the chat. Great, so we can go ahead and get started. So with a little bit of background, why are we focusing on infection prevention and control? So first, infectious disease infects all of us. And second, the American Indian Alaska Native population is disproportionately affected by infectious disease. Since the COVID-19 pandemic, the world has been more aware of how infectious disease can affect our day-to-day lives. The pandemic also really further illuminated that cracks that already existed in the United States healthcare system. And we really saw these stark disparities in access to care for those who are most vulnerable in the Native community. And this is a pattern that is not unique to COVID-19. Other infectious diseases like hepatitis C disproportionately affect AIAN people. And this has ramifications for the individual, their families, and the healthcare workers that are treating them. As I said, infectious disease affects us all. So why are we focusing on healthcare workers? Well, unsurprisingly, healthcare workers are at an increased risk for contracting and spreading infectious diseases since they spend their days working in a healthcare setting. These germs can live in reservoirs like the body and the environment, which means that the skin, devices, sinks, laundry, needles, and more are all potential sites for infection risk. And another major crack in the healthcare system is gaps in preparedness and knowledge about IPC among healthcare workers. During the pandemic, there were other contributing factors to the struggles that we're seeing in the healthcare systems, like lack of personal protective equipment, hospital equipment, sanitizing supplies, and even water. Healthcare workers have had to endure inadequate preparedness, emotional challenges, insufficient equipment and information, underfunding, and worker burnout. And in the wake of the pandemic, we want to look at systems level efforts to reinvest in our systems and healthcare workers that can help mitigate local transmission, conserve support and protect staff, eliminate non-urgent strains on the system, and coordinate communication. So to tie this all together, why do we want to focus on urban Indian organizations? UIOs are unique because in addition to common healthcare providers like doctors and nurses and medical assistants, there are other types of workers who are a part of this setting that might not come from a clinical background. This might be community health workers, traditional healers, wellness workers, transportation coordinators, case managers, or other types of culture keepers. And just like any other provider, these workers are also susceptible to infectious diseases and can also play a role in preventing the spread of disease. So in the past, NCUIH has done some training for this population, which has covered IPC practices for really niche settings and UIO settings, like sweat lodges and for powwows. And this was really based on input that we've gotten from UIO workers. But what we still don't know is what facilitators and barriers to successful IPC practices still exist for our UIO healthcare workers as focus shifts away from the COVID-19 pandemic. So we do want to acknowledge that NCUIH is proud to partner with Project Firstline as supported through our cooperative agreement, which is supporting this particular project. The CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. Project Firstline is a national collaborative that's led by the CDC to provide infection control training and education to frontline workers. And NCUIH is one of more than 75 partners across the country who are working to provide innovative and accessible infection control education to prevent infectious disease threats in healthcare. So in addition to alignment with UIO priorities, this project is also aligning with Project Firstline values. So Project Firstline is different from a lot of other IPC programs because it aims to listen to healthcare workers, appreciate the value of every healthcare worker and the role that they play in infection and control, meet healthcare workers where they are, and recognize that bandwidth is low due to burnout and trauma. So all of these attributes align with the needs of UIL healthcare workers, which really makes this project well aligned with the goals of everyone who's involved. We want to provide a quick overview of what this project is and the methodology we'll be using, which is PhotoVoice. So if you aren't familiar, PhotoVoice methodology was first published by Wang and Burris in 1997, but this type of storytelling predates this publication. PhotoVoice is when participants use videos or photography to capture different aspects of their experience and their environment, something that's very common in Indigenous communities, teaching through storytelling. So on the right side of the slide here, you can see that these are kind of the goals of PhotoVoice, and those are threefold. So helping those who are often heard get a voice, encouraging critical consciousness, and bringing about change that will improve conditions and enhance lives by reaching and influencing policymakers. And we've used each of these goals to guide this project. So this is our mission statement that our project has created, and this is really what drives the project and serves as a reminder for why we're doing this work. So I'll just read it aloud. So the National Council of Urban Indian Health, NCUIH, Project Firstline team will aim to highlight and amplify members of the Urban Indian Organization Health workforce to share insights on their experiences through a catalog of images that spark dialogue among stakeholders about the settings and contexts that healthcare workers enter every day to meet the unique needs relevant to infection prevention and control. You've likely seen this before in our promotion because we really want everyone to know why we're doing this work as well. So our ultimate target population for this project, again, is urban Indian organization staff, and we're encouraging Indigenous and non-Indigenous staff to participate. We also welcome UIOs who have partnered with NCUIH, as well as those who have not, to be part of this project. And ultimately, we'll have 10 people in all with up to UIOs with no more than 2 staff members per site participating. I'm going to take a moment to read through the project goals just so that we're all on the same page. So the first is participants will send NCUIH a PhotoVoice journal, including a self-curated collection of photos describing their needs and challenges they face, excuse me. And these photos are going to be accompanied by a narrative explanation that really contextualizes the images and shows what the needs are. The second goal is increased opportunity for UIO staff to reflect and share their day-to-day experiences implementing and executing IPC practices at their facilities. And the last one is increased knowledge from synthesizing themes from the photos and experiences shared by UIOs to inform future programming, case studies, and technical assistance. For this project, we really want to center Indigenous knowledge, so we've integrated that wherever we can. So prior to recruitment for this project, our department did a train the trainer with Indigenous facilitators on PhotoVoice and qualitative research. So in addition to making sure all of our staff is up to date on the methodology, we're also able to learn about how to integrate Indigenous values into the work. In addition to that formal training, we have 3 Indigenous staff members from different nations across the US who each provide lived experience to this work. I being one of them, as well as Alyssa. Another consideration is acknowledgement that culture is a form of disease prevention. So as a project, we really want to look outside of our ideas of what disease prevention can look like. And finally, we acknowledge that there is historical trauma associated with doing this kind of research and work in our communities. So we've taken several steps to respond to this, and we'll be talking a little bit more about that later. All right, so now that I've done the overview and given some background, we'll get into the participant commitments, or more simply, what do I have to do? So this table here shows the commitments that are necessary for participants of this project. The largest time commitment is that there will be focus groups. So there'll be 4 in total, starting with an introductory meeting, and that will take the longest. So in that first meeting, we'll again go over the project, do some technical training, and then we'll also have some short discussion. The other 3 meetings will involve 2 check-in meetings and then a final meeting, and overall that will take about 5 hours. Although we encourage people to participate in the focus groups, because that's a really important part of community building and storytelling and information sharing, we also recognize that sometimes people might feel uncomfortable sharing particular topics with a group, or sometimes life just happens and you can't make it. So we will also be offering a one-on-one interview option. The next commitment is a questionnaire. After each focus group or interview, each participant will be asked to complete a short questionnaire. And this questionnaire will give time for the participant to reflect on the session and also provide feedback to the NCUIH staff so that adjustments can be made over the life of the project. In addition, to receive compensation, which I'll talk about in a moment, participants will need to complete the questionnaire before anything is distributed. The next allocated time commitment is the final exhibition. We want to be able to share all of this great work with everyone in our communities, so there is time set aside to do that at the end of the project. And I will note that the exhibition and all of the focus groups will be taking place in a virtual setting. The other 2 activities time commitment really depends on the individual. Photography is the actual taking of photographs and writing narratives about the photographs. This might take you hours, it might only take you a few minutes. It really depends on you. And similarly, we're asking participants to reflect on themselves during the project. Sometimes you have a lot to say, sometimes you have very little to say. And we want to provide as much freedom as possible with those 2 activities in particular. So we have created some templates for people who might need help getting started, but it's really driven by the participants about what they want to share. And all of these skills will be discussed and worked on more during the project with the participants. So while the time commitment lies with those who are ultimately participating in this project, we also want to take a moment to discuss leadership commitment as well. Even though you might not be the one doing the work, your support is really instrumental to this project being successful. So that's why we're asking you to think about these following commitments. And I will note that the term leader is not just for the UIO executive directors or the CEOs. While your support is also very needed, there are many other leaders at your organization, including those potential participants who should think about these as well. So the first one is trust your employees. Hearing about taking pictures about IPC, especially in a clinical setting, can set off some red flags and lead to concern. But it's really important to trust that you and your fellow employees have the training and the confidence to follow through with all the policies you have in place to protect your staff and your community. The next one is respect. So respect employee boundaries and group confidentiality. I know this can feel like a really cool project. You want to know everything about it, what was talked about, what your employee learned, and you can ask, but also don't feel offended if they don't want to share either. Group confidentiality is, again, really key to community building. So sometimes not everything can or should be shared outside the project group. The next one is communicate. So reach out to the NCUIH staff with questions. There are no stupid questions. If you, another staff, a community member, anyone has a question about the project at any time, just reach out to us. We're available by email and phone, and we want to make sure that everyone feels good about this work. The next one is to learn. So be open to learning and to listening. Whether the topics that are discussed are easy or hard to hear, we ask that you're open to learning and listening about strengths and areas of improvement. This project is not meant to be punitive or to shame anyone. So if you get feedback from an employee, whether it's good or bad, know that it comes from a place of wanting to get better. And then the last one is to reflect and to think about policy implications. So we often don't know what we don't know. So as this project goes on, think about how your UIO policies can be updated to better fit the needs of your staff and patient population. All right, so now let's talk about some of the benefits. So first, each participant will be compensated up to $250 in accordance to NCUIH, CDC, and UIO guidelines. We want to make sure that participants feel that they're being valued in this work. Second, each UIO will be given a camera valued at $100, which the UIO will be able to keep. Next, the participants will be given technical training on how to use the camera at the start of the project and throughout the course of it as well. Next, this will also be an opportunity to build community with workers outside of your UIO that you might not have interacted with otherwise. You might learn some great tips about how to do IPC at your own UIO. Next, you'll be able to influence future programming and policy efforts here at NCUIH, and then also, we hope, more widely. And then finally, all participants will have the opportunity for authorship on future publications and conference presentations. We want to ensure that this work is shared widely, so we've undergone ethical review so that we can do that, and details of authorship can be discussed for those who are interested. We really believe that each of these benefits provides a unique opportunity for individual as UIO professional development. So now I'm going to pass it off to Alyssa, who's actually going to show an example of a PhotoVoice project that we did as part of our Train the Trainer training.
Great, thank you, Zoe. Yeah, we thought it might be helpful for you all to get a visual of what a PhotoVoice project might look like. So for this project, we were asked to capture and reflect on things in our daily life that motivate us in our career. I don't have the narrative portion that goes with the photos on this particular slide. However, I'll just sort of orally explain them to you. But this first picture here, the one that's a photo of Lily, this flower represents my dog. Her name is Lily. She's really my best friend. She's a flower in my life, and so she's definitely something that motivates me, making sure I can provide for her. The one that says centered, the one of my stethoscope. My nursing career is really getting my RN license was one of my proudest moments. I'm a first generation college student. My family to enter the healthcare workforce as a frontline worker. And this is really what I center my whole career on, is that desire and passion to help people. And then the picture on the right here, adventure. Anyone who knows me knows I love to travel. And so these are just a few artifacts that I've acquired through my travels. And of course, to travel, you need to have money. So definitely motivates me to go to work every day and make sure that I can afford that. And then the one on the bottom left here of the corn called Traditions and Generations. So this is a picture, this was from the fall, it was on the desk. my dad grew those Indian corn, and it really just reminds me of family and my relatives and everyone in my great-grandfather, he worked for the Bureau of Indian Affairs. My grandfather worked for the IHS clinic on the Yakima Reservation. And so it just reminds me that everyone in my family's been working and serving Indian country, and I want to continue that through my career. And then the last one, which is a fireplace at my parents' house, self-standing. This one just simply represents my passionate desire to be independent. I love fireplaces. I've always wanted a fireplace. And actually, I can say now that I have a fireplace. This was taken before I had one, but this is what I sort of came up with when I was asked to reflect on what motivates me in my career. And I found it very beneficial and almost healing in the sense, I know we're all feeling burnout in one way or another in our careers. Some of us are burned out in life. And really stepping back and thinking about why we're doing this it was really a great experience for me. And I will now pass it over to Zoe, who's going to share her PhotoVoice experience as well.
Thanks, Melissa. I won't go into as much detail as you because I want to make sure we have time to do it, but these were the photos that I took. So a couple of them are, well, a lot of them involve plants. So we can see one that's the street that I live on. So talking about change, this was taken during the fall and all the leaves were starting to change. I have a hydroponic garden, so I really love plants and I wasn't really sure how to do it in my tiny apartment in Chicago. But I've been able to grow medicine and plants and teas and fruit, and that's been really great. I also have grief here. So this was a tea that was given to me by a Nipmuc relative. Again, really special to me. I drink it. It reminds me of the historical things that my people have gone through, that Native people have gone through. But again, this was a project that we did over 3 days, 4 days, and we were able to take the pictures, we wrote narratives, and have them all be cohesive and share with one another. So really just want to demonstrate that there's a lot of ways that this can look, and we really want to be able to capture those experiences. You can go to the next slide. Thank you. The last thing we want to discuss before the open floor is our ethical review process. So this project underwent review by the Center for Disease Control and Prevention Office of Science Priorities. Specifically, it's called STARS, or the Studying, Tracking, and Review System, and it's kind of like an IRB review. And those are all of the materials that were reviewed, so everything from the goals and objectives to our consent forms and the questionnaire. So what exactly does doing a STARS review mean for this project? Well, so again, like I mentioned earlier, it means that we're able to publish the data that we have, but it also ensures that the CDC does not have any access to the raw data. Anything that is shared with them will be cleared with participants beforehand. Second, data is stored in a password protected folder and is only accessible to people that are part of this project. Also, anything that participants don't want shared will not be shared. That could be with the CDC, with other participants, other NCUIH staff. And then finally, you can change your mind. If you decide the information that you shared a month ago, you don't really want to be published anymore or analyzed, that's fine. Just let us know. The only exception is that if something is already be published and publicly distributed, we might be able to change future iterations, but we can't take back what's already out in the sphere. The other thing we really want to cover is patient protections. Protecting patients is of the utmost importance for us at NCUIH, and I'm sure for all of you too. As it relates to pictures, participants will not be allowed to take pictures of clients, patients, or protected health information. In addition, although it's great to have community events, you cannot take pictures of community members. So kind of like the examples that Alyssa and I had, it might be, of a tent, but it's not of any people at the tent. So again, underneath the no picture umbrella, we are asking all UIO staff, including non-participants, to complete a photo release. And the release will state that the staff member either does or does not want to be photographed. So if they deny being photographed, they will not be. We also want to talk about HIPAA considerations. Before any photo is brought to the larger group discussion, NCUIH staff will screen the photos to ensure that no one from that no pictures group is included. And while NCUIH staff plans to do this, we do encourage you to have discussions with individual staff about HIPAA and also recommend that you review your HIPAA training before taking part in this project. We also note that kind of returning to the leadership commitment, we are not asking and do not endorse leadership screening all the photos before they're sent to NCUIH staff. While we do have plans in place if a breach should occur, we again want to trust that people have done their due diligence to protect patients. Next slide, please. Thank you. Our team also wants to show that we're dedicated to this project and to your staff and to your communities. So first, all the people who work on this project are encouraged to journal. Journaling helps us to capture any thoughts that might come up and help us to address any personal bias or thoughts that could influence the work. And similarly, we've all created reflexivity statements, and these statements are meant to help each of us understand how we are interacting with the work, what skills we're bringing, and also where we might need our fellow staff members to support us. We've also all done human subjects training, and we've received certificates through the city human subjects training platform. Prior to the creation of this project, we wanted to do our best to be aware of what has and has not been done in PhotoVoice projects. So we researched past projects that have been done with healthcare workers as well as with Indigenous populations to help and guide this work. And then finally, we have several process evaluation tools in place so that we're able to shift directions as needed so that we can fit the needs of our participants. As it relates to ethical considerations and providing transparency to people who might encounter this project, we have several materials that will be given to participants and the UIOs they work with. All participants, so those who are taking the pictures, attending photo groups or focus groups, will each be asked to fill out a consent form, and we'll walk through this consent form with each participant to ensure they understand everything that's outlined. We'll also be providing photo release forms for all UIO staff. And again, we'll ask that staff fill this out to let us know if they're okay with being photographed or not. This can sound like a lot to keep track of. So we also have a reminder sheet that each participant will have so they can make sure they're on top of those tasks. We'll also have emails that can be sent out to employees, clients, and community members, which details what the project is and how to get in contact with NCUIH staff. And similarly, we'll have flyers that you can put up in the UIO to let people know about the project. And then finally, we have some written language and frequently asked questions you can use to help other people understand more about the project. So as we bring this section to a close, these are just a few more frequently asked questions. So again, what will be done to protect privacy? So consent, confidentiality, data transparency, and effective communication strategies have all been put in place to protect privacy. And there's, again, always an open door policy for the NCUIH staff for comments and concerns. The next question, who will have access to the raw data and photos? Only the NCUIH project leads who directly work with analyzing the data will have access to it. What if we don't want anything shared or change our mind? You can withdraw from the project at any time or change your mind or are sharing data, again, except if data has already been published or circulated. Do the photos have to be perfect or free of error? No, we want to encapsulate your actual experience. Real life is really complex and it's messy and it is never perfect or free of error. So this work should also and can reflect that. And then the last one, what if we can't or prefer not to attend focus groups? Again, we really want to emphasize the community building, but you'll always have the option to meet separately with NCUIH project leads. All right, so now you've heard about this great project. So what do you do next? So if you are a staff member, feel free to talk to your manager, your CEO, if this is a good opportunity for you. And if you are a supervisor, feel free to talk to any staff who you think might be a good fit for this project. These next two bubbles kind of go with one another. If this feels like a good opportunity, go ahead and fill out an application. And if you have any questions, don't hesitate to reach out to us. And after you submit, you'll receive an email from our team to confirm that we got your application. and the applications close on April 5th. So you'll expect to hear a decision and more details after that. Finally, before we go to the open floor, I wanted to just quickly share the application questions. The first two groups of questions are pretty straightforward: name, email, what your job title is. We also asked some UIO specific questions just that we can kind of understand how your UIO functions. So if you've worked with us before, your CEO contact, those kinds of things. And then the last two questions ask you to just let us know why you want to be part of the project, and you can feel free to write as much or as little as you would like. All right. Thank you all for listening and learning more about this project. We now have an open floor, so if there are any questions, feel free to come off mute, or you can also put them in the chat as well.
Get us started with a question, Zoe. I'll go ahead and put it in the chat as well. But so can we only take pictures, or are we allowed to take video or use other types of art?
Yes, so you can also take video. If you can also use different types of art as well. We again really want to make sure that the materials that participants are producing make sense for them. If you don't feel like a picture is working and you would rather do a video, that's fine too. We will make it work.
And are all UIO positions eligible to participate?
Yes, all UIO positions are eligible to participate. So again, you don't have to be a doctor, you don't have to be a nurse practitioner. Anyone is welcome to participate. Again, also if you have a staff member who might not feel as technically or technologically inclined, we're also more than happy to work with you so that they feel supported throughout the project. So any position is welcome to participate.
Will there be any technical training that goes along with photo taking if we're not very good at taking pictures?
Yes, we have a great NCUIH staff member who's going to do some technical training during the first session that we have. And in addition to that, we'll also have some other technical training throughout the project, and we're always available for one-on-one support as well. And then I see Evie's question in the chat. Will there be templates available to use for us to use to record our writing? Yes, we will be providing templates for it. So it will show you where your picture can go. It will have where the narrative can go. We will also be providing some guiding questions in case you need help getting started with that. And they'll be submitted. It will really depend on the participant, but we'll let you know during the during the project, excuse me, when exactly they need to be submitted. But typically for each of the check-in sessions, so at the first one, the second one, and then the last one, you should have some pictures ready.
So is there another way that journaling can be done if we don't really like writing things down?
Yes, if you don't feel comfortable with writing, there are some other options too. A lot of people like to audio record themselves. So if you feel more comfortable doing an audio recording, you could feel free to do that. Similarly, if you feel like you want to take a video of yourself, you can do that too. Ultimately, we'll still do the transcription and make sure that we have something written down. But whatever is most useful for you is best. Again, we really want to integrate the Indigenous knowledge piece of it. A lot of how stories are told is verbally in our communities, so we want that to come across here as well.
I know we have a couple of UIO staff on the call. If you have any questions that come up later, you can always reach out to Zoe or myself. Feel free to put them in the chat now. And we'll be sharing the slides, correct, Zoe? So they'll have access to them.
Yeah. All right, I'll give it another moment, but if nobody has any other questions, then we can go ahead to our closing. Where can we reach you at? Great question, Tara. You can reach us at my email, which is zharris@ncui.org, or if you email ipc@ncui.org, you can reach us as well. And this information is on the application as well. You're welcome. So again, before we close today's event, we just want to remind you to visit our website to access and share resources and listen to our podcast. We also have an animated public service announcement that reminds healthcare warriors about hand cleaning protocols. You can also go ahead and download our IPC infographic. We will also be having a new one that we're releasing soon, so we're really excited to have more flyers, more infographics that you all can put up in your UIOs about IPC. You can also feel free to check out these upcoming events and opportunities that NCUI has coming up. And finally, NCUI offers technical assistance to our member UIOs on all types of topics and more, so feel free to reach out if you are in need of assistance. So thank you all, Katapas on the Move, for attending, and we're looking forward to receiving your submissions. And we will also stay on for a little bit longer in case anybody else has any more questions. Thanks again.